Severe hip arthritis can be quite debilitating for patients. The symptoms are generally pain in the hip as well as stiffness in the hip. And once the arthritis gets severe, this really can limit the patient's ability to perform the activities that they enjoy doing or that they need to do for work. And it can also make basic activities such as walking, putting on socks and shoes, going up and down stairs, and getting in and out of a car more difficult. Patients should consider hip replacement once their activities are limited due to their symptoms, and if they're having trouble with basic activities like walking and getting in and out of a car. Hip replacement can really be a life-changing operation for patients that gives them near complete pain relief and really improves the range of motion and function of their hip. In a hip replacement surgery, we remove the arthritic portions of the joint and replace them with metal and plastic components. So this entails a titanium shell which goes into the femur bone, which is hollow, then a ceramic ball that goes on top of that metal stem, and then on the other side of the joint, you have a metal shell that goes into the pelvis and a piece of plastic that locks into that, and the ceramic articulates with that plastic shell, and this makes a very durable construct with minimal wear that should last patients a long time. There are two main approaches or ways to get into the hip joint for hip replacement surgery, and those are the anterior approach, which means from the front, and then the posterior approach, which means from the back. These are both very successful ways to do the operation, and I do both of them. However, I do prefer the anterior approach for a couple of different reasons. First, there is some literature showing that the early recovery is easier for patients. Second, there is some research showing that the rate of dislocation is lower with the anterior approach. And then thirdly, during anterior approach surgery, we're able to use X-ray, which allows us the ability to make sure that we're putting the implants in the correct position for each patient. One thing that I think sets St. Joe's apart is that we have a great rapid recovery joint replacement program. The vast majority of our hip replacement patients now go home the same day. We have a great support system for them at home. And with improvements in our surgical technique and implants, patients tend to recover very quickly, and the implants have the potential to last them a lifetime.